Welcome to Texas 2036's new virtual series, Straight Talk Texas, where you have a front row seat to conversations on topics important to our future. My name is Enisha Williams, Director of Board and External Affairs here at Texas 2036. I am pleased to present today's conversation featuring Texas 2036 President and CEO, Margaret Spellings, who will have a discussion on health with our founder and chairman, Tom Luce. Over to you, Margaret.
Thanks, Anisha, and thanks for all you're doing to organize these virtual seminars. Hello, all, and thanks for taking time to join the conversation today. As you can imagine, the recent events and challenges of the pandemic are causing all of us to reflect on our systems of government at all levels and our readiness to adapt. That's true for every organization, of course, including Texas 2036, and that's why we're thinking hard about the way forward and the policy implications of the virus, both short and long term. Today, I'll be talking with the founder and my friend, the chairman of the board of Texas 2036, Tom Luce. Tom and I have known each other for more years than either of us cares to remember. He's someone who's put himself on the field of play in many policy areas, from education, where we first met, to health and mental health. One recent assignment was his appointment to the Texas Sunset Commission when it was evaluating the work of all of our health and human service agencies back in 2015. And I'm wondering how much things have changed since then, Tom, if at all. During that time, he became an expert on the issues confronting these agencies and the challenges for Texans and their government. Tom is well equipped to give some context and some advice as we ready our state for the days and months ahead. Tom, thanks for taking time to visit today, and I'll just jump in on the first question. I know you are an avid reader and sending things around. What are your observations about what COVID-19 is teaching us about our health systems and our government organizations in response to this pandemic?
Well, I'd say first, Margaret, I worry about, is it teaching us anything, or is it revealing the strengths and weaknesses of our system? I think the jury's out as to whether it will teach us things. I hope it does. It's revealing a lot of things that have been apparent for a while. And of course, they're exaggerated by the current COVID virus, as is most of what's happening in society. But, you know, it's revealing the fact that we have a large portion of our population that does not have availability at an affordable price of health care. And the lesson I hope we're all learning is that the population of every person in society impacts each and every one of us, either in an economic sense or a societal impact. You know, what happens to your neighbor does matter. And this virus is showing us that, and therefore it's showing some of the weaknesses in our system. Now, we've got huge strengths. You've seen innovation, you've seen entrepreneurship, you've seen people rising to the occasion, you know, all the things that make, in some respects, our healthcare system so one of the greatest in the world. But it also is showing the weaknesses that ride alongside all of those strengths.
So let's talk about public health in particular. You talked about that connectedness between you and your neighbor, and that your neighbor's health matters for a lot of reasons, just like your neighbor's educational attainment level can matter too. But talk about public health. Do you see Texans and Americans complying with these directives? Can we do it over the long haul? Is this a realistic solution while therapies and other techniques come on board?
Well, not yet, because I think the first step that we've learned worldwide is testing. And Texas right now is trailing some of our peer states in terms of the amount of tests we've been able to administer. Best I can tell statewide, we've probably only tested 35,000 people, and we're a population of about 29 million. So when you look at the stories about the number of cases that have tested positive, you have to keep in mind, we haven't tested that many people. And absent expanding testing, policymakers necessarily fall back on mass isolation, and the economic impacts of that are enormous. And it hurts our society and it hurts people. And yet there isn't an alternative except testing, which then enables you to tackle it in a more strategic way, which enables the economy to open up.
Well, as you know, we're now one of the minority number of states, and maybe it's because of our size in particular, who has this very decentralized, do your own thing, county judges and mayors taking the helm. Is that the right thing for the moment, or how do you see that longer term?
Well, again, I think there's strengths and weaknesses, but it is pointing out, and I think it does fail. For instance, as usual, there may be a middle ground. For instance, I think what it fails to take into account sufficiently is that so many of our areas really operate on a regional economic basis. And so North Texas really is an economic area. The greater Houston area is an economic area. The Austin, San Antonio area, the Rio Grande Valley, the El Paso, the West Texas hubs in Amarillo and Lubbock. And so if you're decentralized within those regions and they're not operating in the same fashion, it causes massive problems. I'll give you an example. In Dallas, and these are rough numbers, the quote population of Dallas County is 2 million. In the daytime, it's 3 million. So that means 1 million people roughly are coming into Dallas from adjoining counties to work. Well, if those counties don't have the same shelter in place or the same testing or the same whatever, then the effectiveness of what you're doing can be greatly diminished. Now, obviously, Texas is a very diverse state, but I worry, and I've talked to some of my friends in various parts of Texas the last couple of days, you know, you can look at data and say, well, golly, they've only got 27 cases in X region. Well, that can crash a healthcare system in that region just as much as 500 cases could crash Dallas. So you have to be careful of knowing we do have to balance, knowing the regional differences, but I think there's a middle ground where we could think about this regionally. And as Margaret, you've always said, the key in government performance often is, are we organized for success? And when it comes to pandemics of this nature, I worry that we're not organized for success.
Yeah, I'm seeing that as as you know, recently moved back here from North Carolina, much more centralized state, and certainly there are pluses and minuses to observe. Okay, Tom, I'm going to make you benevolent dictator of Texas for the next few minutes and ask you a couple questions.
Oh, gee, yeah. How do you do that, Margaret?
Benevolent.
Okay.
Tell me what you think about obviously we're about to get a bunch of federal money. If you were the decider, how would you think about prioritizing those resources? And then secondly, a little bit longer horizon, if the legislature comes back either in a special session or in the early part of next year, as we know they will, how should they be thinking about what to do first? What are you observing?
Well, I think we've got to take care of two critical immediate needs. One is we cannot afford a loss of a year of learning in a child or in the education system because of how the brain's developing, falling behind. And I know you'll cover that in a different subject. In healthcare, though, we have got to take into account the landscape is going to change dramatically as a result of the pandemic. And what I mean by that, well, in addition to the fact that we've always led the nation in uninsured population, that's even going to explode further because of job losses, because the greatest number of people in Texas have always been covered by private insurance through their job. And as you look at the mounting unemployment, that's going to mean a lot of people laid off that may lose their private insurance, depending upon the employer, because although they have the right under federal law to buy that insurance for a while, they may not be able to afford to do so. So we may all of a sudden be expanding the number of people who do not have insurance. Now, I think we have to put in context insurance. There may be, again, a middle ground. Insurance is not the end-all, be-all. You can have insurance and not have availability of the healthcare you need at an affordable cost. So availability and cost are the critical ingredients. We have to address availability and affordability of the right kind of care at the right time, of the basics. I'm not talking about, making sure everybody can get their hip replaced or cosmetic surgery or, hair growth, but I think you have to make sure people can get primary care, can get attention to things that will help keep them healthy. Right now, we're not doing very well on health outcomes. And a little notice thing about what's happening right now, a lot of primary care doctors are being hurt financially because all of a sudden they are not seeing patients. Now they're trying to do it by telemedicine, but we're going to see a lot of ripple effects through the healthcare sector. And we have to address those healthcare needs immediately, because it impacts society, it impacts your economy, it impacts your growth. We have to address the new healthcare landscape immediately.
Let's talk about your advice to the legislature then, a little longer term. I mean, the kinds of things that you're talking about, obviously the testing, the understanding of public health and whatnot. Let's say we were sitting here 3 years from now. What would you hope the Texas health system in a public sense might look like? I have my own ideas, as you can imagine, as it relates to kids and schools and whatnot, which are leveraged resources. But
I hope, number one, we have got to expand. And listen, let me say this to help people with some assurance. We have a couple of great leaders on that front in Senator Jane Nelson and Representative Forprice. Unfortunately, we lost John Zerwas, who retired, but he's now in the middle of the strike force getting medical supplies. So he's continuing to serve us all. But we have to get to where we can manage the health system better. That means more investment in IT, more investment in data, more investment in what are we paying for in terms of value and outcomes. And those are long-term projects that will have to take place probably through several legislative sessions. But for instance, we've got to incentivize people to get primary care and get basic care because it costs us less in the long term. The example I use, people ask me, well, is healthcare right? Well, to me, it's almost a false argument in this sense. If you get run over by a car, we take you to the emergency room and we're not going to let you die. But the taxpayer ends up paying for that. Now, what would be better for society and for taxpayers is that we do whatever we can to incentivize you to get the things that prevent you from getting seriously ill. Diabetes is a great example. We need more delivery of early diagnosis, early treatment, making sure people are taking their medicine or their insulin, even if you have to go to a home. That's cheaper than amputating limbs. So we've got to restructure our healthcare system, or the state won't be able to afford it. Texas 2036 has run rough projections that say the state budget would be consumed over 70% by healthcare in 2036 if we don't get a better control of how much we're paying for healthcare. And yet, we're at the bottom in most rankings of healthcare outcomes. That's not a sustainable model. And then it's going to be compounded by the economic distress that the state is going to suffer. Our unemployment is unfortunately and tragically rising rapidly in a way we've never experienced.
Exactly. Well, Tom, I'm going to add an amendment to that, and that is that we need to leverage our public sector platforms, our colleges and universities, our public schools as proliferators of some of those good habits. We're seeing that as we understand how vital schools are to nutrition, and that many kids get most of their meals at our public schools and so forth. So we can do a better job of leveraging those systems. Listen, before we run out of time here, I want to ask you about mental health, and since that's something that you've labored in so long, and we often think about health as something that is only in your body, and we separate mental health from health care and health. Give us your take on that. This disaster is having some real serious implications for mental health consequences.
It really is, Margaret, unfortunately. And again, the pandemic reveals underlying potentials and problems. And we're going to see a lot of anxiety, depression, more serious mental health problems, spousal abuse, child abuse. And we just have to, long-term, my dream, and I think everybody should have the dream, we need an integrated healthcare system. And by that, I mean, we have to quit saying, well, you have a mental health problem, go over here to the left, or you have a physical health care, go over here to the right. That's not the way the body and the soul works. And that's not the way the mind works. We're finding that out. And it shouldn't be a shock to anybody that often people have coexisting physical and mental problems. Often, if you have cancer, you have depression to deal with. And if you're not dealing with the depression, you're not effectively helping your immune system deal with cancer. Yeah. And so we've got to get better at that. We've got to get what I call our historic healthcare systems, our hospitals, our specialists, our primary care doctors, our pediatricians, knowledgeable about dispensing the triangulation of mental and physical health needs. For instance, there's available research now from UT Southwestern that would empower a pediatrician to ask 7 or 8 questions on an iPad and know whether or not the child is facing a potential mental health issue, and give them the resources to know where to direct that person. So we've got a lot of changes to make in the healthcare system, but maybe this pandemic will spur us to even improve our healthcare system. I'm always a person who says the glass is half full, and I think this would be no, I mean, and this is a wonderful opportunity to say, what do we need to do to keep Texas healthy?
Yeah. Before I turn back to Anisha, I just want to ask you what advice you have for all of us and how you're staying healthy, get beyond the hand washing and the surface cleaning and all of that.
Well, first of all, I have forbidden my doctor from calling me a member of the vulnerable population. I said, just go back to calling me old. And then I am practicing social distancing. I haven't been out of the house in 4 or 5 days, and I'm really trying to be good about that. I'm being very cautious. Fortunately, I'm surrounded by friends and family that are dropping groceries off. But I think, we all have to take into account, it's just not about ourselves. It is really about who are we impacting. And what is so deadly and serious about this pandemic is that people who do not know it are carrying around symptoms and infecting other people. And the only way to stop it is to really be careful.
Good advice. Thank you. Thank you, Tom, for being with us. Anisha, I'll turn back to you to close us out, and look forward to visiting with folks over the series here that we're doing at Texas 2036.
Thank you, Margaret and Tom, for that incredible discussion. And thank you all for watching Straight Talk Texas. If you have questions and feedback, we want to hear from you. Email straighttalk@texas2036.org. And please be sure to sign up to receive our emails, follow us on social media, and visit texas2036.org for more information. Until next time, wishing you and your family well.